We had published the initial results of the study early last year with around 2 years of follow-up, and we did find high rates of response in both CLL and mantle cell. We saw very good tolerability. We were able to identify the recommended phase 2 dose of the Umbralisib drug as 800 milligrams in combination with standard dose Ibrutinib. The challenge with that early report was that the follow-up was quite short. And so really the idea with our update at the EHA meeting is now with around closer to 4 years of follow-up, looking at the progression-free and overall survival for these very high-risk patients. The other thing that we looked at actually was the rates of complete remission, which did increase a bit over time, as we've seen with B-cell receptor pathway inhibitors, and that was the case in our study as well. So really what we thought were the key updates from this poster were the PFS and OS data. Now with mantle cell lymphoma, these didn't change too much. The median PFS was only around 11 months in this very high risk population, although the median OS was about 2.5 years. To us, this didn't look too different from Ibrutinib as a monotherapy, but certainly looked no worse, but really hard to know if there's a difference there. But where we're really, I think, seeing a difference is with the CLL patients. Obviously, we're comparing to historical controls. There's no randomized comparator here, but we did see a 4-year PFS in this high-risk CLL population of close to 80%, and a 4-year overall survival of 90% in the CLL population, with many patients still on the two-drug combination doing very well. So I think our data set here really highlights both the efficacy and the safety of dual B-cell receptor blockade, and I think this really does warrant further study.